people said he's speaking Odia English. I said, what is Odia English? He said that his tonality neither is Hindi or neither is English. It is Odia English. Because obviously our pronunciation will differ from place to place. That is all over the world. Because that is not our mother tongue.
Same, I think for every language, it will vary from place to place. Even we all
Not
have some.
Not every language, all languages.
Yeah,
For your information, this is Government India printout. Every 8 kilometers, the language changes in India. Every 8 kilometers. In Odisha, the Odia is spoken in western part of the state, and the language spoken in Balasore, which is more Bengali than Odia. It makes a lot of, but we write all as script is same. But then the language, the tonality undergoes a change. Or the Odia spoken in Barampur. Yes, I think time is over.
Yes, sir.
Sir, yes, sir, 8 o'clock now. Sharp.
Can I start, sir?
Yes.
Jai Jagannath, Namaskar. Happy Saturday evening to all of you, ladies and gentlemen. First of all, my prayers to the Lord, to the Almighty, whose blessings and grace continues, and most of us are safe. Well, I am Hiranya Mohanty, and on behalf of Odia Samaj, welcome you all to the 4th wellness session being organized by Odia Samaj COVID Care, an initiative of Odia Samaj, New Delhi. Friends, in recent past, because of this COVID-19 infections, we have lost so many illustrious, beautiful, lovable souls in the country and fellow Odias with whom we must have remained connected in some way or other. On behalf of Odia Samaj, I extend our sincere condolences to the immediate families of the departed soul and offer our prayers and Shraddhanjali to the departed souls to rest in peace. Om Shanti, Om Shanti, Om Shanti. Ladies and gentlemen, I take this opportunity to introduce briefly Odia Samaj as an organization registered as a trust, not for profit, and is primarily meant for promoting the rich heritage, culture, literature, art form, Jagannath Sanskriti of Odisha, and to celebrate the life and achievement of indomitable Odias and the indomitable spirit of Odisha. During this pandemic, Odia Samaj has started a free telemedicine platform named of Odia Samaj COVID Care to provide free teleconsultations to the COVID patients across the country, including rural Odisha. The inspiration behind this initiative is no other than a fellow doctor, Odia doctor, Dr. Ashok Chaudhary, and Vibio Health India Business for extending its support to make our telemedicine platform successful. With this platform, I'm happy to report that approximately 500 patients, mostly from rural Odisha, with the help of our panel of doctors, they are taking the facility of this telemedicine and free consultations. I really salute all the doctors in our panel for their commitment to the cause. To take today's session forward on the subject care for mother and child in COVID, a few practical tips. I invite and welcome our today's keynote speaker, experts, Professor Chandrasekhar Bala, Professor Susmita Swain, Dr. Vishnupriya Sahu, kindly on board for this session, along with our moderator of the session, Dr. Archana Nirula. Now I invite our mentor, President of Odia Samaj, Sri Siddharth Pradhan, to kindly chair and bless the session to commence. Over to Siddharth Pradhan, sir.
Namaskar, Jai Jagannath. Ajira Sandhyare, I got a series of webinar ame aram karuchu. It is my pleasure that Odia Samaj has, in this very difficult time, started this telemedicine where we are giving advice, medicine, and prescription to the patients all over the country, especially in backward areas of Odisha. Today's topic is very topical. Care for mother and child during COVID. The unsung hero of this telemedicine is a panel of doctors who are daily on call from 9 a.m. to 9 p.m. These young doctors, daily they look after about 30 to 40 patients. It seems that every day the graph is rising. I salute to the dedication, to the perseverance, and also spending a lot of that time in rolling out prescriptions, medicines, advice, how the patients should come out of COVID. I don't like to speak anything further. Now I request the moderator to please take over. Dr. Archana Nirola. Thank you. Pandya Utkal Janan.
Thank you, Siddharth Pradhan ji, and sabko mera bahut bahut namaskar and a warm welcome to all our attendees, all our participants, and our dedicated doctor team. Also, I also grant a very warm welcome to our keynote speaker, Dr. Chandrasekhar. Dr. Chandrasekhar is MD DNB, Professor and Head of Nuclear Medicine Department of AIIMS, Delhi. Welcome, Doctor. And first of all, Dr. Chandrasekhar is going to present a very small presentation to us, in which he is going to share very valuable data coming from very integrated sources. And we are looking forward to your presentation, Dr. Bhatt.
Thank you. You have not made me host, or how can you put the sharing there? It's not allowing.
Sir, there is a green button where it is mentioned a share screen. You just need to press that button, and through that you can open your PPT.
It is supposed to open that, but it's not opening. Is my slide visible now? No.
No, Doctor.
No, that's why I'm telling you, it has to share. Share option is...
Kindly click on your share screen option at the bottom of the screen. You'll have a share screen.
Yeah, I have a share screen, that green button going up, but that is showing first option saying one participant can share at a time. The number 2 is multiple shares simultaneously, advanced share options.
सर आपको सिर्फ शेयर स्क्रीन पे क्लिक करना है, उस एरो पे साथ वाले पे क्लिक नहीं.
Just click on the green box, Doctor.
Okay. I think I have come.
Yes, sir.
Okay. So, okay, this is okay. Today I am going to talk something about, I'm really thankful to Hiranmaya and Dr. Pradhan, Mr. Pradhan for allowing me to speak on this forum. I am not very outset. I want to say I am not a COVIDologist, and neither I am a gynecologist nor a pediatrician. Then why I am here? I am just going to talk during this pandemic for last 15 months. There is infodemics. There is a lot of wrong things. There is a lot of right things. That have a lot of guesswork, and most of the so-called experts are nothing better than the astrologers. So it has proven that somebody told you, if you do the 1 day Janta curfew, there will be body blow to corona. Then somebody told if you lock down for 15 days till May 15, there will be not a single molecule of RNA that will be present. And then somebody never expected about a second wave. Now somebody is talking about third wave. So there is a lot of misconception about the treatment, about the predictions, and everything has gone wrong. But what I am going to talk in this next 8 to 10 minutes is the facts that is available before us. And this fact is based on CDC, which is a very reliable evidence-based data collection, highly verified and authenticated data. And I'm going to talk about the maternal and birth outcome of hospitalized pregnant women with laboratory confirmed COVID-19. They're all laboratory confirmed. And this data varies from March 1st to August 22nd, 2020. And it is from the US, 13 states participated in this program. Approximately 1 in 4 hospitalized women aged between 15 to 49 years with COVID-19 was pregnant. A total 598 hospitalized pregnant women with COVID-19, median age was 29 years. Even in US, between 15 to 24 years, there are 28% were pregnant. And we thought it is only in India, which will be such a low age of pregnancy. But in US also, 15 to 24 years is 28%. 25 to 30 years, which is a normal pregnant age group, even in our country, majority, it will be 53%. And even late pregnancy, 35 to 49 constitute around 29%, 19%. So there were 326 were asymptomatic at admission, means slightly half of them were symptomatic, whereas a little bit more than half were asymptomatic, and 272 were symptomatic, and there was, out of that, 16.2% were admitted to ICU, and 8.5% required invasive mechanical ventilation. So they needed ventilators. What are the signs, symptoms when they are hospitalized admission among these pregnant patients? You can see the most common sign symptoms was fever, chill, rigor, cough, shortness of breath, muscle aches, nausea, vomiting, headache. And you can see those who are in the first trimester is in the different color, and then in the third trimester, you can see most of the time they are almost same. So what trimester is not immaterial. And even some people have got elderly or these pregnant mothers had diarrhea and decreased taste and smell. These are the lower part. But unlike in children, there is nasal congestion, rhinorrhea is much less. Chest, abdomen, sore throat, headache was also very high. But the commonest feature was fever, chill, cough, and shortness of breath. So as you know, because they are pregnant, there are only 132 patients had a chest X-ray, and infiltration consolidation was in 78%, bronchopneumonia in 30%, pleural effusion was very low, only 2%. When some of them underwent the chest CT because of certain region, the confirmed chest X-ray finding except added effusion, all these similar finding, except 15% people had effusion, pleural effusion, which is expected because in chest CT you can, a small amount of effusion may be missed in chest X-ray. So what I'm trying to say, what you can see in the chest X-ray, you can see in the CT, but CT gives lots of radiation to the patient, and particularly in the pregnant patient, you should avoid. And chest X-ray is sufficient enough to give all the information. So median ICU stay was 5 days, starting from 2 to 13 days. Among 598 pregnant patients, 14%, that is 14% were in the first trimester, 10% were in the second trimester, and 87.4% were in the third trimester of pregnancy. During hospitalization, 458 completed pregnancy, that completed. And out of them, 31% were among the symptomatic patients and 69 among the asymptomatic patients. So the reason is that when they are admitted for pregnancy, they have done the test and the test turned out to be COVID positive. That's the reason why there is 70 and 30. In hospital, death of pregnant mothers was in 2 out of 598. In hospital, newborn death was again 2, and live birth in 448 patients, and pregnancy loss was in 10 patients. So it is about 98% versus 2%. Pregnancy loss before 20 weeks were in 4. Pregnancy loss after 20 weeks was in 5, and one patient there was no history known. Whereas the term delivery was more than 37 weeks, is in almost 88%, and preterm was in 13%. What are the implications of public health practice? Pregnant women and healthcare providers should be aware of the potential risk for severe COVID-19, including adverse pregnancy outcomes, pregnancy loss in 2% and mortality in 1%. Identifying COVID-19 during hospitalization is important to guide preventive measures to protect pregnant women, parents, newborns, and other patients, and hospital personnel also. They may further spread the disease. Take home message: pregnant women should avoid close contact with person with confirmed or suspected COVID-19, maintain 6 feet of distance from non-household members, and COVID appropriate behavior like behaviors including wearing masks, practicing hand hygiene, and CDC recommends testing newborn delivered from COVID-19 positive mothers. Continued surveillance to improve health outcomes for mothers and newborn. And in this study, there was no vertical transmission. That means from mother to newborn was not noted. What happened in children? There was 12,306 patient study. It's a retrospective cohort study from the COVID-net. And as you know, over 4.2 million children in the United States had COVID positive since the onset of the pandemic. In comparison with adults, preliminary report suggests that children, that is in America it is 18 years, but in India we have got a dubious. We have 12-year children and 18 years adult. Between 12 to 18 we don't have any definite definition. So if you take 18 years up to children in US, had relatively lower odds of adverse clinical outcome associated with COVID. It's much better in children. Children and adolescent accounts for 13% of total COVID cases in US. The study outcome, that is hospitalization, mechanical ventilation, ICU, were assessed during logistic regression analysis. Nearly 3/4 of the children did not have any of the typical COVID symptoms. As we told, in case of pregnant ladies, it was 55% had no, but in children, 75% had no symptoms of any COVID features. Among 12,300 children with lab confirmed COVID, 16.5% presented with cough, dyspnea, and 13.9% had nausea, vomiting, diarrhea, abdominal pain, 8% had rash, and 4.8% headache. You can see the contrast to the adults. 18.8% had other non-specific symptoms in the form of fever, malaise, myalgia, arthralgia, and disturbance of smell and taste. 672 out of 12,700 positive patients needed hospitalization. That is 5.5% only were hospitalized. Out of this 5.5%, 17.6% required ICU care and 4.1% needed mechanical ventilation, whereas they lost 10 patients. So if you take only the hospitalized patients, this case fatality rate is 1.5%. But if you take the overall, compare 10 divided by 12,306, it is 0.01%. So in pediatric population is much better compared to adults. Hospitalized children had a greater prevalence of fever, respiratory, gastrointestinal symptoms, and higher prevalence of comorbidities. Hospitalization was needed in 3.5% of patients who had no sign symptoms nor no comorbidities. That is 67% had no comorbidities. Here means somebody has got hematological problems, somebody has renal problems, somebody had immunological problems, somebody had got cardiac problems, somebody has lung disease, somebody has got asthma. These are all comorbidities. They are hypertension. They have been all added together, but only 33%, whereas 67% had no comorbidities. Among the patients who had no comorbidities, only 3.5% needed hospitalization, 0.4% needed ICU, and 0.3% required mechanical ventilation. That means if you don't have comorbidity and you are a child, very unlikely you will have any mishap. Clinical outcomes were similar among boys and girls. There was no sex difference in the boys and girls. What is the now government of India, the Ministry of Health and Welfare has given a management for the children which are asymptomatic or mild disease. That mild disease could be just fever or rhinorrhea, running nose. They don't need any sort of hospitalization. They need just isolation. And if there is fever, you can just give them paracetamol. They don't need any sorts of intervention. And if it's moderate, and how you define the moderate, that has been discussed. A child can be categorized as moderate COVID if he or she has the following rapid respiratory rate. That's not very easy to diagnose, anybody can. If it is a respiratory rate is more than 60 per minute for less than 2 months, and then 50 for 2 to 12 months, and 40 between 1 to 5 years, and 30 between for more than 5 years. And adult, it is around 14 to 16. So if in children, if it is more than 30 and you are more than 5 years, you should consider as moderate. And these things have been, and oxygen saturation, if all these age group above 90%. If it is above 90%, you can say moderate. And if your respiratory rate is high, then you can consider as moderate, and that needs that again needs only home isolation and occasional maybe consultation with the pediatrician. For a severe one, when the respiratory oxygen saturation below 90%, and that time it needs hospitalization, and if there is other comorbidities, definitely needs chest X-ray, CT scan, and maybe required, and dexamethasone is required. That is the only proven therapy, and oxygen therapy is very much required. Whether it can be given through the nasal cannula or face mask, that is what is recommended. Thank you. I think I have summarized all the data that is available to us, and that in pregnant ladies there is very little risk if you are managing them very properly, and if it in children, mild, moderate, home isolation, no need of hospitalization, no need of rushing to them. Maximum they need is only paracetamol. And if there is moderate to severe, you may consult the doctor and maybe needed a pediatric ICU support. That's what I want to say. Thank you.
Thank you, Doctor. Thank you, Dr. Chandrasekhar. In these COVID times, there is a lot of anxiety and worry among the people. And on top of it, there is a lot of unverified and confusing information present on the social media. So this is scaring and producing more tension and anxiety among the general population. So thanks. I am very much obliged to you to share such authentic and genuine data to us. And I'm very sure that many of us who are listening, who are attached to this webinar, would have found it very, very useful. Thank you once again.
I would like to say that there is a lot of fear mongers among the media. They're telling this third wave is coming for the children, is going to wash out our younger generation, and all these are rubbish. There is nothing in the data that has been published showing that even 75% children, even they get infected, there will be nothing. And out of that, only 3 to 5% may need some hospital care. Otherwise, 95% will be in home care. And just like any viral fever, you have got a sore throat, or you have got fever, you have got tonsillitis, just like you take sometimes little bit of antibiotic and paracetamol antibiotic, you are fine. Same like that. But this fear monger started telling the school should be closed, this should be done, this that should be done. All this is because this closing the school is the easiest thing that can be done by the government. Because all the school, whether private or government, they come under the government rules. They cannot close the shops. They can close the school at any drop of the hat. So that's what I wanted to say. Even with the 12,000 data available patients, and it's very authentic data published on CDC, showing that in 75% in US, there is no problem in children. Only 3 to 4% of children need only hospital care. And out of that, maybe 0.3 or 0.4% may need invasive therapy or ICU care. So less than 0.5% will need any ICU care. That's what I'm trying to say.
Thank you so much, Doctor. I'm very, very sure कि बहुत रिलीफ मिला होगा सबको ये जानकर जो आपने हमारे साथ डेटा शेयर किया कि अभी हमें इतना नहीं घबराना है, things are not that bad as they are projected by the media and the news. So thank you so much, and let's proceed forward with the webinar. I am now going to welcome two very eminent panelists who have agreed to enlighten us further by giving us practical tips on how to take care of the mother and child in the COVID time. So please welcome Dr. Sasmita. Dr. Sasmita is a very senior gynecologist. She's MD, FICOG. She's a professor and head of department of obstetrics and gynecology, SCB Hospital College and Hospital, Cuttack. And we also extend a very warm welcome to Dr. Bisnu Priya. Dr. Bisnu Priya is MD Pediatrics, and she's the Assistant Professor of Pediatrics at the SGT University, Gurgaon. So I'm giving you a very, very warm welcome. I'm so obliged that both of you have consented to help us out और हमें information देने के लिए कि क्या practical tips हम use कर सकते हैं mother और child को COVID के समय protection के लिए. सबसे पहले Dr. Sasmita, I can start with you. Now the COVID pandemic is spreading all over the country, and as a gynecologist, what are the responsibilities of the husband and the family members which you can advise to keep the pregnant woman healthy and safe?
To the Odia Samaj for giving me.
डॉक्टर सस्मिता, आपका थोड़ा सा ऑडियो आपका ऑन है, थोड़ा सा आप पास आके बोले.
Yes.
हाँ जी.
So family always play a major role in taking care of the pregnant woman, and their role is much more now in this pandemic, because the pandemic, this COVID pandemic has created a fear in everybody's mind. So their role is to play a major role in giving the support to the pregnant woman, so can we have a healthy mother and healthy baby, which is the future of the nation. So we should make.
मैडम थोड़ा साउंड बढ़ा दीजिए, अब साउंड थोड़ा बढ़ा दीजिए.
डॉक्टर सस्मिता, आपके स्क्रीन के नीचे वहां पर एक ऑडियो का है, माइक्रोफोन का इमेज होगा, आप उसको क्लिक करें.
Okay, I'm using the earphone then. Hello, am I audible?
Yeah.
So family always play a major role in taking care of the pregnant woman, and the family's role is much more now in this pandemic, because all of us are definitely under stress due to this pandemic effect. And if you can relieve the stress of the mother, she will able to deliver a healthy child, who is the future of us and our nation. So what care we should give? We should make the pregnant woman feel that she is special, and we should take special care of the pregnant woman, especially the husband. She should listen to her, talk to her, and accompany her to the hospital while going for the checkup. And it is the lookout of the family members that the pregnant woman take the nutritious diet. That is very important, and takes the medicine prescribed by the doctor at time. And also rest and sleep, which is a major part in delivering a healthy baby, should be adequate. They should see that she gets adequate rest and sleep, 2 hours in the afternoon and 8 hours at the night. And they should discuss about where to deliver and who should accompany the pregnant woman during delivery, because this is very important. Nowadays, to have a pleasant and joyful birth experience, government has allowed to accompany one person who is known as the birth companion, who should be decided from the very beginning, who will accompany the lady when she goes into labor. So that should be discussed, and if the patient goes into labor during this time, the birth companion should put on the PPE and stay during the delivery, so that the stress of the woman will be relieved and she can have a happy delivery. Similarly, many of our patients, bahut jana ebe bahare rahuchanti, away from the family, they are staying alone, the husband, wife are staying alone. There is nobody to help them. So in those cases, they have to create their own support system, like their friends, their neighbors, their colleagues. They should stand with the pregnant woman and help her and support her both mentally and also physically. So we have to create our support system. Family, when away from home, the persons who are nearby, they becomes our family, and they should give the support so that we have a healthy delivery.
Yes, ma'am, I do agree कि अगर हम husband और family support करे pregnant lady को, I think she will be able to manage the delivery part as well as getting the baby back home. She will be much more confident and she will have a safe delivery. So I agree with you. And बहुत ही valid point आपने बोला कि जो birth companion का arrangement किया है with PPE kit, I think that will be a very big support system. Yes, ma'am.
That should
also-
be decided from the very beginning, who will accompany her, so that will give her mental support to the pregnant woman.
Yes, ma'am, right, ma'am. Also, ma'am, when a lady is pregnant, she has to go to the hospital for a number of checkups. We call them the antenatal checkups. So,
Yes.
in this COVID pandemic scenario, does she have to go for those regular ANC checkups like we have in first trimester, second trimester, or she can make some changes, or her gynecologist can make a few changes?
So in normal period, we usually ask the pregnant woman to come for checkup around 14 to 15 times, depending on her condition. But in this pandemic period, it has been reduced to minimum 4 visits, which is around 3 months, 5 months, 7 months, and 9 months. 3 मास, 5 मास, 7 मास, 9 मास रे आसिले भी it will be sufficient to continue the pregnancy safely. So if the woman knows that she is pregnant by testing her morning urine by the pregnancy kit, and she is confirmed that she is pregnant, without waiting for the doctor consultation, she should start taking folic acid. Folic acid is easily available, and it is very important to take folic acid in the first trimester to prevent fetal anomalies. So she should start taking the folic acid, and if everything is normal and she does not have any danger signs in first trimester, that is, if she is not having any bleeding PV, or there is no reeling of hair or syncopal or unconsciousness, or there is no excessive vomiting, then she can come for checkup at 12 weeks or 3 months. So at that checkup, while going to the checkup, it is ideal that she should go to the nearby health center. Don't go far away. Avoid distance traveling. And when you are going for checkup, you should go by your own vehicle, which is more safer. And also, most important, the pregnant woman should use a surgical mask or an N95 mask, which is more protective than the commonly used cotton mask. Because it has been seen that pregnant women, though they are not more affected by the COVID in comparison to the normal population, but when affected, the risk or danger is much more in them. So as far as possible, we should always try to avoid that she gets affected by the COVID. So once she gets to the hospital, she should have the basic checkup and the investigation done, which will be advised by the doctor. So basically, we advise for hemoglobin, blood grouping, RS typing, glucose test, whether she is diabetic or not, if there is any urine infection not, or if it required, ultrasound has to be done. So once the basic investigation is done, she will be advised the medicines. And everything is normal, she can come back at home. And at home, she can herself also take care of her pregnancy by taking the nutritious diet and the medicine advised by the doctor, and she should check up her weight every 15 days. Normally during pregnancy, we have a weight gain of 10 to 11 kilogram. So this weight gain, if it is weight is not gaining or there is excessive weight gain, then she has to see her blood pressure. That is also very important. If we can have a digital blood pressure, घरे मध्य हमें blood pressure देखी परिबा. जदि हमारा blood pressure 140/90, if our blood pressure is less than 140/90, then it is good. But once our blood pressure increases more than 1/90, we have to consult our doctor, because hypertension during pregnancy is a very important cause of maternal morbidity and mortality. सुनो हमें घरे निजर blood pressure देखी कि जानी परिबा हमें blood pressure ठीक अछि कि नहीं. If it is less than 140/90, then we are safe. Similarly, we can basic blood glucose level we should first check. If it is less than 140 after taking 75 grams of glucose, then we don't have diabetes, because these are the comorbidities which are dangerous for the pregnant woman. High blood pressure, diabetes, obesity, heart disease, एगुड़ा का हमको exclude करे पड़िबो. जदि एगुड़ी को हमें नाही, हमें घरे मध्ये एगुड़ा चेक कर परिबा बारंबार. Ebang 28 weeks परिबा 7 मास परे, we can also check the daily fetal movement count. After 7 months, we can go for daily fetal movement count, which we tell DFMC. If the daily fetal movement count, that is, if it is more than 10 in 12 hours, then we are sure that our fetus is healthy. So for 12 hours, we can count from 6 a.m. to 6 p.m. If within this period, if fetus moves 10 times, we are sure that our fetus is healthy. So we need not be panicky. So if you find any abnormality, you can consult your doctor by telephone, WhatsApp, or your telemedicine. You can consult your doctor and go for checkup.
Thank you, doctor. That means कि all the people who are listening to this webinar, और जो भी इनमें pregnant ladies हैं या family में कोई pregnant lady है, so Dr. Sasmita wants us to know that अब उतनी routine checkups की जरूरत नहीं है. Only important checkups are needed, ma'am. Like you said, especially अगर comorbidities या कोई diabetes का या blood pressure का लग रहा है कुछ problem, तो ही अपने डॉक्टर को तो अपने ऊपर अच्छे से अपना चेकअप करते रहें. ब्लड प्रेशर मशीन घर में ही ले सकते हैं आप, उसको भी चेक करें. डेली फीटल मूवमेंट भी चेक करें. और अगर कुछ प्रॉब्लम हो तो मैम जैसे बता रही हैं कि हमें टेलीमेडिसिन या फोन पे अपने डॉक्टर से बातचीत कर लेनी चाहिए. थैंक यू सो मच एंड आई एम होप सबको ये बहुत अच्छी जानकारी मिली होगी. इट मस्ट बी वेरी यूजफुल फॉर एनीबडी इन योर फैमिली हु इज प्रेग्नेंट. सो मैम, वन मोर क्वेश्चन आई वांट टू आस्क यू. If suppose there is a family member who has COVID infection, then in that case, if the woman is pregnant, how should she protect herself and from the infection?
So if the family member is positive, then the positive person should isolate himself or herself. And if there are other members, if the home facility is available, and if other family members are there to take care of the person, then they should not allow the pregnant woman to come in contact of the affected person. जदि घरे सुविधा अच्छी रहिबार गर्भवती महिलाटी को कोविड होइतबा पेशेंट पाखको जिबाको दियंतु नाही. कारण गर्भवती महिलाटी जदि कोविड हुए ताले हमर रिस्क अधिका रहिছে साधारण लोकंक ठारू. So if एटा बडी काटिले जदि किसी सुविधा बहुत लोग जहाँ कहली कि they are staying outside, they are staying alone. So if there is no other possibility who can help them, then the pregnant woman should use a N95 or surgical mask, and the affected person also, he should also use a mask so that the transmission rate will be less. We can protect ourselves, and they should always maintain a 6 feet distance, minimum 6 feet distance, and the pregnant woman should always use the hand sanitizer. 60 to 90% alcohol based hand sanitizer should be used, and the hand washing, frequent hand washing should be done, and the things used by the affected person, she should not come in contact with these things. If it is because the fomites, they are also responsible for the transmission. If we touch those things and touch our eyes, nose or mouth, we can be affected by the COVID. So we should take care that the things used by the affected person should not come in the contact. And along with that, she should continue taking her medicine advised by the doctors. And along with that, as per the contacts also, we should protect ourselves by increasing our immunity, by taking nutritious diet and strong willpower. Yes, I can fight. I can. That is very, very important. Strong willpower, increase your immunity, and continue your medicine. That will also, we have to do that.
Okay. So the message we take back home is be positive and सब कुछ ठीक होगा, चिंता ना करें. So let's go let's go forward, and अब कुछ जानकारी डॉक्टर विष्णुप्रिया से लेते हैं. Dr. Vishnupriya, there is a fear among the pregnant women that if she goes to the hospital for a delivery, there are chances that the newborn baby can get COVID infection from the hospital. सो कितना चांसेस है मैम, ऐसा क्या होता है, चांसेस है कि बेबी को डिलीवरी के बाद एकदम से कोविड हो जाएगा?
First of all, I thank you to Siddharth sir and Hiranya sir to give me the opportunity to share my experience and knowledge in this platform. So let us add with the question. Yes, mother, whether COVID positive or negative, but that has to be tested before we taking the delivery. And if mother is COVID negative, so all precautions what we normally taken for the deliveries that should be taken. But if the mother is COVID positive, so all precautions, what is the PPE kit and other protective equipment to be taken. But what is the risk to getting the infection from mother to baby, that is not exactly clear to anybody. No data is also available. But yes, to prevent the hospital acquired infection, all measures should be taken from both sides, as from the care provider as well as from the mother and health care providers. So and at present everybody is aware regarding this, how will prevent the transmission by social distancing and by wearing the mask, that is known to everybody. So by this we can minimize the infection that may get from any health personnel to the baby.
So that means we should not worry and delivery करने के लिए hospital जाना चाहिए and पूरी care करनी चाहिए अपनी भी, और ताकि आपको full protection from your side as to not to get any hospital acquired infection. So Dr. Bisnu Priya, suppose the mother is COVID positive and after delivery, she wants to breastfeed the baby. So should she breastfeed the baby? And if yes, she can breastfeed, what are the precautions she can take while breastfeeding?
Okay. So one thing I want to tell, there should not be any doubt whether mother is COVID positive or not. The breastfeeding should be continued as before, as it is done by each and every mother before the pandemic. Okay. But if mother is COVID positive, but we have to take some extra precautions like the proper hand hygiene and proper respiratory hygiene, so that the common mode of infection that can be prevented. And mother should wear the medical mask properly, because this is the protective means is more compared to the non-medical mask, so that should be properly wear. And second, sometimes at the beginning of the pandemic in the last year, everybody is worried about whether we'll isolate the mother or baby, but at present it is very clear we should not separate the mother and baby. We should practice the rooming in process what we will do prior to the pandemic. So mother and baby should be remain side by side as in the previous times, and breastfeed should be continue with confidently, but mother should take all the precautions. And second thing, mother should be vigilant for some danger signs in the baby. If by any chance the baby develops certain infection related to COVID or any other thing, like the baby is lethargic, not accepting feed, or the palm and soles are more cool, so she should be in constant touch with the pediatrician or neonatologist, so that if anything happens, that can be handled in time.
Okay. So ma'am, connected to this question, there is also a question in the mind of many people in the general public, that is it safe to take COVID vaccine for for breastfeeding mothers? Like recently, it has been allowed by the medical fraternity in India that COVID vaccine can be taken by breastfeeding and lactating mothers. So according to you, is it safe to take the vaccine? Because people are still very scared and worried.
So I think it is the last week, the health ministry and the technical advisory group in India, they permitted all the lactating mother, they can vaccinate normally as per the other people's same 2 doses, and they can take at any time of lactation, whether it is a beginning or it is the continuation phase and the baby is little bit older, but no difference is there among a lactating mother and a normal person regarding the immunization. And even if the mother is received the vaccine, so there should not be any interruption in breastfeeding. Breastfeeding should be continue as before, as the mother is doing it before the vaccination. So there is no doubt or no risk to the baby ki if the mother is taking vaccine, there is some problem to the baby.
Okay, so the takeaway message you want to give to the general public is that if the vaccine is available for lactating mothers, we should not worry and we should go ahead and take the vaccine for our protection as well as protection for the baby and the rest of the family.
Exactly.
Correct, ma'am?
Archana, can I just intervene?
Yes,
I
sir.
want to share a fact that the mother's milk, the vaginal swab, the amniotic fluid, the placental extract, the uterine swab, all of them have been cultured and they found no iota of corona retrovirus in the sample. So there is no evidence of vertical transmission from mother to baby. And there is no virus that comes through the mother's milk. So only problem is that when the mother is trying to feed the baby may mouth may be touching the organs which are already contaminated. That's why the mother has to really prepare the organ before feeding the baby and take proper care, double masking, and then using the hand sanitization and properly cleaning the breast before feeding the baby. These are the protection measure has been advised. Otherwise, there is no way the virus can go through the mother's milk.
Sir, I want to differ a little. Sir, in our hospital, we are having a dedicated COVID hospital, and all those mothers who are delivering and the baby needs essential treatment, they are being referred to there, and there we have to do the antigen test. And most of the time, we are finding the baby to be antigen positive.
Yeah, the baby gets antigen because of the surrounding, not from the mother.
So
Yes.
immediately, no, sir, immediately it has been now shown that it is being vertically transmitted. Some papers have come out.
But those are very, because if it is not coming through the placenta, then how it is coming to the baby? There is no connection. You know, as a gynecologist, I should not argue with you. There is no way the mother, though all the time mother says my part of my body, the mother and babies never their blood samples circulation will come only during the separation of the placenta, some few drops of blood that enters into the mother. Otherwise, there is a barrier between the mother and baby. So if the virus is not present in the placenta, how can it comes to the baby?
I don't know, studies are going on, but
because of the environmental features. So because there is in a COVID ward, you know, that is hardly any prevention measure is taken. All the time they are all exposed to the hospital staff. They don't know how to do donning and doffing. They don't know how to handle the baby, newborn. All these are the reason why they get infection very fast.
Dr. Chandrasekhar, now we are talking about protection. Can you elaborate? I think many people in the audience would want to know double masking and single mask, cloth mask and surgical mask. Can you just explain double masking kaise karte hain?
Yeah, you see why the question of if you use any cloth mask and you will not protect yourself. When you are using a surgical mask, why the concept of surgical mask came? Because the surgeons, when they will be operating in the OT, they will be asking nurses to give the instruments. And when they will be talking, somebody may spit. And then the oral secretion will come to the operation field. That's why the surgical mask was only to prevent the contamination from you going to the environment. But N95 mask, which prevents not only the you spitting out, also the air that is coming through the filtration. So double masking is the reason when you can use a surgical mask or a cloth mask, and above that, if you are using an N95 mask, that is called double masking.
Okay, thank you, sir.
Protects it.
Thank you for the information. Dr. Sasmita, can I ask you one thing? There is a question among the people. Abhi, just a second wave was there, and in the second wave, lot of news we heard about pregnant women getting in COVID infection. And if the COVID infected mother, she goes for moderate to severe case of corona, then do you think the doctor, what is the role of CT scan? She should not take CT scan if she's pregnant, because CT scan is equal to as if 1,000 is equal to this, the power of a CT scan is equal to that of 1,000 X-rays. That is what it has been said. So what is your comment on a CT scan given to a pregnant mother?
If the pregnant mother is severely affected, our priority is to save the mother. So if it is indicated to do the CT scan, we will definitely go to do it to save the mother with all precautions.
But then it will affect the baby in some way.
But mother is the priority.
No, ma'am. If the baby is already beyond 28 weeks, there is no need of any restriction, but you should not, radiation, not only is, radiation has also other hazards. If you are not in 1000 X-ray, but it is one normal X-ray gives very little, about 0.01 millisievert, and a CT scan gives around, for a chest CT gives around 15 millisievert. So it can 15 divided by 0.1, it is 150 times more. So it will be 150 times more millisieverts in that sense. 0.1 versus 15 is 150 times X-ray. But what is now debated is not doing first time doing a CT scan. For the first time you do a CT scan is for scoring purpose. That is called CT scoring. So all the 5 lobes, the right lobe has, the right lung has 3 lobes, and left lung has got 2 lobes. So each lobe has got 5 points. So if 25 total number is 25. 25 is coming from because each lobe has 5 points, and then you add to 25. So first time, if you want to know, because less than 10 will considered as mild. Between 10 to 15, it is called moderate. And if the CT score is more than 16 to 25, it is severe. So that's why for the first time, because chest X-ray is not that great in doing scoring. After that subsequent follow-up, you need just a chest X-ray. There's no need of repeatedly doing CT scan and unnecessarily giving radiation to the mother. That's
Yes.
that.
So if it is indicated, then
Yes.
otherwise no need to do
For
it.
one time, it is okay. There is no problem. But subsequently, people are what they are doing every 2 days. They are getting a CT scan done. That's wrong.
Mhm. Also, Dr. Sasmita, outside India, what is your suggestion? Suppose the COVID vaccine comes, the health authorities advise the pregnant ladies to take the COVID vaccine. Do you think it would be safe, and the women should go ahead and take it?
So at present, our guidelines does not allow pregnant women to take the vaccine. The last clinical trial, which was done to know the safety and efficacy of the COVID-19 vaccine, they had not included the pregnant women. So the safety and efficacy of the vaccine is not tested in pregnant women. But till now, so it is not advocated in our country, but in UK they have already started it. Specifically, they are giving the choice to the pregnant women whether to take it or not. If COVID, like those persons who are pregnant women who are working in the healthcare setups, those going outside, those having comorbidities like diabetes, hypertension, obesity, heart disease. So in those cases, if they get COVID, it is more dangerous. So they are being given by the choice to take the vaccine. But in our country, it is still not recommended. We do not know. Evidence will come. May short period. We may also, it may be allowed also in pregnant women.
Hopefully,
But
I
till
think
now, it is not
yes,
allowed.
ma'am. But I'm hoping that it will come. Then it will be a big relief, I think. And even if it comes, ma'am, the second trimester, we can try to give COVID vaccine. That it should be safe if given in the second trimester. What is your comment on it?
It is a dead vaccine, so
Yes.
it may not have much effect, but studies will tell. We cannot, guidelines we cannot make.
Yes, ma'am. Thank you. Dr. Bishnupriya, suppose the baby is a newborn baby is there, and we have to take the baby for the DPT vaccination and at 1.5 months, and so do you think it is advisable, or because people, I am sure in the remote areas that the ASHA worker or the primary health center would be calling the mothers to come for the baby vaccination, but the mothers and the family people are refusing that no, do not go to the hospital or the primary health center for the baby vaccination. Then do you think it is, what should be your advice in this scenario?
In this scenario, I just want to suggest that the routine immunization process should not be in a hold. It should be continuous before, because the previous experience shows if during this pandemic, at a time, single point of time, the mass vaccination is stopped, then this vaccine preventable disease, they are emerges to produces the epidemics. So like measles epidemics and the pertussis like epidemics. So it is there in the past, but for this scenario, the routine immunization should not be hold. But one thing everybody should be keep in mind. So it is a shared responsibility between the parents as well as healthcare provider or the persons who are posted in the immunization center for vaccinations to minimize the risk of transmission. So all the precautionary measures that we all know, gathering should be avoided. So for vaccination, the parents should encourage, and a time slot facilities should be there so that we can avoid the crowding in a single point of time. And in time slot wise, we take small parents on appointment and will do the vaccination. And second, if the immunization clinic, if the infrastructure is allowed, the immunization clinic should be a separate room from the general OPD, so that it also prevents to some extent, and also it minimizes the risk of spread of infection. And during the process of immunization, again, we keep all these things in mind, to wear the mask, to wear the gloves, so that the transmission should be minimized. But parent has to be strongly encouraged, and they have to be told about the risk if they are not taking the vaccines. So that has to be encountered, and at any point of time, if there is no major reason why they are not able to come, then they should come to the hospital in time as per the given schedule, and they must immunize their baby in time.
Okay, thank you, ma'am. So please, all of you, the participants, बहुत ज़्यादा ज़रूरी है कि हमें अपने बच्चों की जो वैक्सीन प्रिवेंटेबल डिजीजेस हैं उसके लिए जरूर जाएं, उसे ना रोके, बिकॉज दैट इज वेरी वेरी इंपॉर्टेंट. नहीं तो वो ज्यादा परेशान करेगी आपके बच्चे को बाद में, रादर देन कंट्रैक्टिंग दी कोविड इन्फेक्शन. और कोविड इन्फेक्शन के लिए तो हम पूरा कोविड रिलेटेड प्रैक्टिसेस को फॉलो करिए, एंड प्लीज गो अहेड to the nearest primary health center and the hospital for routine vaccinations. That is very important. Dr. Vishnupriya, let's go from here to the children now in the age group of 1 to 18. Now we are all hearing that there is a lot of fear among the people कि अब third wave आएगा और third wave में बच्चे ही involve होंगे. And I don't know, I myself feel this is not genuine and this is unverified. Social media be spread हो रहा है, but it is creating a lot of stress among the parents. So they are worried now that the children are going to get affected in the next so-called third wave. We are not even sure there's going to be a third wave. But still, what is your message to all the parents, how to protect their children from the age group of 1 to 18?
Yeah, so already this topic has emphasized by Bal sir in the beginning of the session. We should not be much more anxious about the third wave. We exactly don't know what is going to happen, but what is the data available till date, whatever the affection of children related to COVID, so it is minimum if the child having no underlying comorbidities like any chronic heart problem or kidney problem or any long liver problem like this, or a child is chronic asthmatic. But other group of high risk children are there, those who are overweight or obese. But it is also noted that the children less than 1 year and the teenagers or the children with overweight and obesities, they have also counted as a risk population to contract that infection. So these are the high risk groups. So first, whatever the precautionary measures till now we have in our hand, we have to follow all the measures which I have already discussed. But one thing I want to emphasize, in children or in pediatric population, the physical involvement is there, but the unseen part is the psychological impact or psychological impact, because nowadays the schools are also closed. The children are there all over the time since morning to night. So there are so many psychological issues are more noticed in the children. So parents must to be extra cautious for that. And they should say at certain times, they should encourage their children to have a healthy lifestyle in the form of doing physical activity, healthy nutrition, and definitely to reduce the non-educational screen times, because these are very important factors that will welcome or that will call for so many other risks or diseases. And apart from that, the parents should give certain time to share the matters or whatever the ongoing things regarding the COVID. They should openly discuss in a healthy way. They should not be guided by the false social media news. They should be shared, and in a healthy discussion should be communicated with their children. And third, if the vaccine will, now it is under trial, the vaccines for less than 18 years, if it is available before the third wave, then this is a very effective step to prevent our children from third wave.
Thank you, ma'am. So I think ये बात even I wanted to discuss that we are all worried about our physical health. What
Yes.
we are not realizing is that because of this lockdown scenario, because of being confined to our homes and not able to meet our relatives, our friends, not able to go to school, colleges, kahin na kahin this is going to have a very bad impact on the mental health of not even adults, even children, even small children, because now they are not able to interact with their friends. That जो एक nurturing होती है, एक regular physical or mental development होता है, that is now more important. We should be worried about mental health as well in the children. So I agree with you. And suppose, ma'am, Dr. Vishnupriya, suppose a child does get COVID infection, as Dr. Chandrasekhar rightly pointed out, all they need is paracetamol. As a child health specialist, do you think that is only paracetamol is needed, or they are going to try the other medications on the children as well? What is the line of treatment we pediatricians are going to look at?
Exactly. So till date, whenever we'll get a children with COVID positive, either it is detected in the process of entire family screening, or if the child having persistent symptoms, then we'll investigate. So these are the ways by which we'll get the information that our child is affected with COVID. But one thing I am telling, if the child is only COVID positive, no other signs and symptoms is there, otherwise the child is fine, I think no treatment should be started. Here, the parents must be vigilant. They should monitor the temperature regularly, and they should watchful for the upcoming signs and symptoms, which usually the child may develop. This is the first step. But if the child is COVID positive and there are certain mild signs and symptoms like just cough, cold, coryza, just normally the children may have in the changeover of the season, or some children may present with some loose motions or vomiting or mild pain abdomen. So they have to be managed symptomatically. So जैसे sir has already told कि simple paracetamol और cough cold के लिए simple cetirizine देना है, या loose motions तो ORS वगैरह that will give. And but in that period of time you must be vigilant and you monitor the temperature. And second thing, you must also try to maintain the hydration, because that is our common experience. Whenever a child is suffering from even common cough and cold, they just used to leave the feeding. So our main target is to maintain all the hydration by anyhow. And if the child is doing all that, then you should be aware of certain danger signs. So like if the child is running high grade fever, or there is breathing difficulty, as the Sarah has told, what are the respiration rate, and if we'll monitor the saturation, then it goes below 94% and the child looks lethargic. So these are all warning signs. So if they are in the form, then you have to be in regular touch with the pediatrician. And if the child is not responding or not getting well by third or fourth day, or he is more symptomatic, then we proceed for all investigations. Or if the child showing danger signs, then the hospitalization should be done. But one thing I should emphasize, parents should not start various antibiotics at their own, or the remdesivir or steroid at the home basis. So it should not be started. I strongly discourage this habit. So always be in touch with your pediatrician. If these things are required, they should be done in the hospital setting. It should not be done as a over-the-counter medication or so much as a self-medication, because we don't know what is the side effect. And we also nowadays encounter the various fungal infections that will come up because of this prevalent steroid use. And they are also have a very side effects in children. So that practice should not be done. And another practice what I will see, because of over anxiety, the parents used to give hot water every day to the children. They keep strong cardas. But I think if the child has no symptoms, they should not do like that. But some multivitamins or vitamin C or zinc, it is well and good, no problem with that. But how much extent it will prevent COVID, we don't know. But overall, if they are giving, it is fine. But they should not take their own hand the remdesivir and steroids. That should not be.
तो दो बातें बहुत जरूरी है. एक तो आई थिंक पेरेंट्स को व्हाट्सएप डॉक्टर्स नहीं बनना चाहिए. हमारी आधी जनता तो व्हाट्सएप डॉक्टर्स बन गई है, और दूसरी आधी जनता जो है वो काढ़ा पी के उसके साइड इफेक्ट्स उनके स्टार्ट हो जाएंगे. हमें तो ये ज्यादा चिंता है एज डॉक्टर्स कि people are having kadas as, as 3 to 4 times in a day. I mean, like I read an article a few days back where one person had severe blood, vomiting and hematemesis and everything. Then it turned out that he was having 4 glasses of kada every day. So I think by the end of this pandemic, half of the population will become WhatsApp doctors and half of the population will end up with some other side effects because of random use of steroids and other these preparations, immunity preparations. So I think we all should be remain in touch with our doctors and be sensible and take their advice and do the right thing. But yes, we have to be vigilant. And I think take care of the red flags. Red flags की knowledge सबको होनी चाहिए, वो बहुत जरूरी है. So I think before our time is also up, we can keep on discussing. But last question I want to ask from Dr. Sasmita, that there are a lot of people, see when the COVID pandemic, ma'am, came last year, there were many people who postponed their pregnancies. And now thinking that COVID might go away in 6 months, but now we are aware of the fact that this COVID infection is here to stay. So ma'am, in this scenario, I have a lot of people who are inquiring that should we postpone our pregnancy and wait for things to get better, or should we go ahead?
So at present, there is no recommendation to delay or postpone the pregnancy.
I think
we are going through a danger period. It is the decision of the couple. Audible?
Yes, ma'am, you're audible.
Okay. So at present, it is the decision of the couple whether they should get pregnant and continue it or not. If they become pregnant, it is well, and they have to take extra care. And they have to take extra care for this COVID pandemic, and they should be ready for that. Mentally, they should be ready for that. And very important, many people have married during this period, and if they do not want to get pregnant or avoid pregnancy at this period, they should take proper care so that they do not have unwanted pregnancy. Jahaku ओडिया रे आमे कहूचु अवांछित गर्भधारण करियारु निजेको दूरे रखंतु. Lots of contraception is available, so if they do not want to get pregnant, they should use the available contraception. For the newly married couple, oral contraceptive pill is the ideal one. They should use it so that they can avoid pregnancy, and unnecessarily they should not go for any termination of pregnancy. एवं जदि कहार गर्भ रही जाइछि किंतु they do not want to continue it, if they are pregnant and they do not want to continue it, they should immediately contact their doctor. If it is within 63 days or 9 weeks of pregnancy or 63 days from the last menstrual period, they should consult their doctor, and if it is found to be inside the uterus, not an ectopic pregnancy, they can terminate the pregnancy by taking only the medicine. If they delay to contact the doctor and want to terminate, then it will be a surgical procedure for which they have to go to the hospital, which is at present is not advisable because most of the hospitals are now COVID hospitals. So as far as possible, we should try to avoid unwanted pregnancy, and those who want to continue pregnancy with all safety measures, they can have their pregnancy and continue it. There is no contraindication to not get pregnant.
Thank you, ma'am. So pregnancy is a personal choice. It is a couple's
personal choice.
Yes. So as long as if you want a pregnancy, your biological clock is ticking away, go ahead. Corona pandemic is here to stay. And otherwise, if you can avoid, it's ma'am has already told of all the procedures, the oral, the abortion pills, as well as avoiding surgical procedures to go to the hospital. So I think we have talked in lots of things, and I'm sure it's going to be very, very useful for all the people who attended. And I want to extend a very, very big thank you to all the doctors who had this very nice discussion with me, and I'm very useful information, and thank you so much for joining this webinar. And over to you, Hiranya ji.
Thank you so much. It's very, very fruitful deliberations in a very simplest manner. And Rachana, you are the best choice to moderate this session.
No.
and we thank you so much. And also you head the medical team and CEO of the BBO Health India business, who is our technology partner for running the telemedicine platform. Thank you so much, Dr. Ratna, for your time.
The pleasure was all mine. I got the opportunity to talk to such eminent doctors. The pleasure was all mine. Thank you so much for having me.
Conducting the session so nicely. And Dr. Vishnupriya, a lot of takeaways from all these discussions and deliberations. You talked about how to protect oneself from the hospital-acquired infections. You talked about vertical transmission of the virus. You talked about the vaccination-related myth. It all will remove the myth, and how to wear the medical mask, double masking while feeding. Lots of takeaways. And I cannot actually touch base all the points. A lot of takeaways really in these deliberations. Thank you so much for being with us in this session. Dr. Professor Sasmita Swai Madam, बहुत बहुत धन्यवाद. अपन बहुत सिंपल मैनर रे समस्तों को एड्रेस करले, कहिले, एक्सप्लेन कर रहे. डेटा बहुत इंपोर्टेंट जिनसे अपन कहिले कि the importance and role of family, husband. And sometimes when there is a nuclear family, the role of the neighbor and friends to support, give the mental support to the pregnant lady. Very beautifully said. This is very important. And you also talked about how we can really measure and monitor our various parameters of comorbidity, BP, diabetic, etc., while staying at home. Thank you so much, ma'am, for giving such a nice input to all our audience. I'm sure audience will take this input and use it in practical life. Dr. Bora sir, a big thank you for giving such a fact and data which is research based and based on evidence. It has really, I don't know, everybody must be, very happy with this data, and definitely it must be, removing the myth and pure psychosis and anxiety relating to this particular situation. Thank you so much for your input, sir. And I must thank you on this occasion because he's not here, but he's our perennial source of inspiration. He's our encouragement. He always encourages us to reach out ODIA wherever they are at the time of crisis. He is no other than Sri Dharmendra Pradhan, Honorable Minister, Petroleum and Natural Gas and Steel. He is our patron. Under his patronage, we do a lot of things, and he is the pride of Odisha. We are proud of you, sir. So thank you so much for your support all the time. I once again thank you to all the participants. We really value your time and patience, and I'm sure you will go away with a lot of takeaways out of these deliberations. Thank you, Siddharth sir, and our team. Sir, you have been motivating us. You have been guiding us to deliver. So we are on the path of our journey, and we'll make this successful telemedicine platform. And before I take the permission of the chair to close the session, I request one thing. I want a place. So let us place that I will not get infected by this virus. The various measures we talked about. If at all I get infected by chance, then I will not let others get infected. So if we take this place, perhaps the spread of virus will stop, get mitigated, and we will stay safe. And with this, have a blissful, happy sleep, and let's look forward for a bright and happy Sunday. Jai Utkal.
Thank you.
Jai Jagannath.
Thank you, sir. Thank you.